What is Partners in Health, PIH, and how did it come to be? As of 2023, Partners in Health, PIH, continues to be a leading non-profit organization in the global health space. The organization's work has taken on new urgency in the wake of the ongoing COVID-19 pandemic, which has highlighted the urgent need for strong healthcare systems and equitable access to medical care. In response to the pandemic, PIH has expanded its operations and worked to adapt its programs and initiatives to address the new challenges posed by COVID-19. The organization has provided medical care and support to communities affected by the pandemic and has worked to ensure that essential medical supplies and equipment are available where they are needed most. PIH has also been actively involved in advocating for equitable access to COVID-19 vaccines and treatments, particularly for marginalized and vulnerable populations. The organization has pushed for increased funding for global health initiatives and has called for a more coordinated global response to the pandemic. In addition to its COVID-19 response efforts, PIH continues to focus on building strong healthcare systems in the countries and regions where it operates. The organization's approach involves working closely with local partners and governments to strengthen healthcare infrastructure and improve access to medical care. PIH has also been involved in a number of research and policy initiatives aimed at addressing global health challenges. The organization's research on infectious diseases, including HIV/AIDS, tuberculosis, and Ebola, has informed its approach to healthcare delivery and has helped to develop new approaches to diagnosis and treatment. Despite ongoing challenges related to funding and resource constraints, PIH remains committed to its mission of promoting health equity and social justice around the world. The organization's work continues to be an important source of inspiration and innovation in the global health community, and its impact is felt by millions of people around the world. Partners in Health, PIH, is a non-profit organization that provides medical care and advocacy for vulnerable communities around the world. The organization was founded in 1987 by Dr. Paul Farmer, Ophelia Dehill, Thomas J. White, Todd McCormack, and Jim Yong Kim. The organization was initially established to provide medical care in rural Haiti, where Dr. Farmer and his colleagues had observed high rates of infectious diseases and other health problems among the population. The founders of PIH believed that healthcare was a basic human right and that everyone, regardless of their financial status, should have access to high-quality medical care. Over the years, PIH has expanded its operations to other countries and regions, including Rwanda, Lesotho, Malawi, Peru, Mexico, Guatemala, Russia, and the United States. The organization's approach involves working with local partners and governments to build strong healthcare systems and provide comprehensive medical care to those in need. PIH has also been involved in advocacy efforts to address systemic issues related to healthcare and poverty, including advocating for the use of generic drugs to treat HIV/AIDS and other diseases, and for increased funding for global health initiatives. The organization has been recognized for its innovative and effective approach to healthcare delivery, and has received support from a variety of sources, including governments, foundations, and individual donors. Since its founding, Partners in Health has continued to expand its operations and adapt to changing global health challenges. The organization has remained committed to its original mission of providing high-quality healthcare to vulnerable communities around the world, and has worked to develop innovative solutions to address the root causes of health disparities. In recent years, PIH has focused on building strong healthcare systems in the countries and regions where it operates, including training and supporting local healthcare workers and partnering with governments to improve healthcare infrastructure. The organization has also worked to address social and economic factors that contribute to poor health outcomes, such as poverty, inequality, and lack of access to education and other basic services. PIH has been involved in a number of high-profile initiatives, including responding to the Ebola outbreak in West Africa, providing medical care and support to earthquake victims in Haiti, and partnering with governments to improve healthcare delivery in Rwanda and other countries. The organization has also been a leading advocate for global health equity, pushing for increased funding and attention to the health needs of marginalized and vulnerable populations. Despite its many successes, PIH continues to face significant challenges in its efforts to promote health equity and social justice. The organization operates in some of the most impoverished and politically unstable regions of the world and faces ongoing funding and resource constraints. Nevertheless, PIH remains committed to its mission and continues to work tirelessly to improve the health and well-being of those it serves. In addition to its work on the ground, Partners in Health has also been involved in research and policy initiatives aimed at addressing global health challenges. The organization has conducted extensive research on infectious diseases, including HIV/AIDS, tuberculosis, and Ebola, and has worked to develop innovative approaches to diagnosis and treatment. PIH has also been involved in advocacy efforts aimed at addressing systemic issues related to global health, including calling for increased funding and support for global health initiatives, and advocating for greater access to affordable medicines and healthcare services. As the world continues to grapple with the ongoing COVID-19 pandemic, PIH has played a critical role in supporting healthcare systems and responding to the crisis. The organization has worked to provide essential medical care and supplies to communities affected by the pandemic, and has advocated for equitable access to COVID-19 vaccines and treatments. Through its many initiatives and partnerships, Partners in Health has demonstrated the power of collaborative, community-based approaches to healthcare delivery and advocacy. The organization remains a leading voice in the global health community, and its work continues to inspire and inform efforts to promote health equity and social justice around the world.